So our second speaker is Brid Walsh, and Brid is she has a wealth of experience. So she has a ton of work experience in the semi-state, and that's coupled with a wealth of experience in community and health settings. She's currently the Regional Health and Safety, Drugs and Alcohol Task Force Coordinator in North Dublin, which is hard for me to remember. She also is so well represented on many committees and subcommittees, and has such a wealth of qualifications. But what I'm just going to mention that she's the chairperson of the Drive Oversight Committee. And for those who don't know, the Drive project is the drug-related intimidation and violence engagement piece of work. So Brid's going to talk about that today, and I'll ask her to come. Thank you very much.
Thanks very much for the invitation, and thanks to Rachel for all of the organisation, and a particular thanks to Roisin from Ballymun, who rescued me from the kitchen about 5 minutes ago because Audrey O'Reilly sent me the wrong direction for the toilets. So thanks for that. So I actually don't have responsibility for health and safety, but I do for the Regional Drug and Alcohol Task Force in North Dublin, but thanks a million for that, an extra responsibility. Absolutely delighted to be here. I wasn't allowed to do chemistry because I was so bad at it, so this presentation is going to be far less technical. And I'm going to be focusing on, it is obviously about Drive, the drug-related intimidation, violence and engagement project, but it's on one specific part of it. So in a way, I need to give a little bit of a disclaimer because it's a very big project and there is a lot of elements to it. But because the focus today is about research and informing research and data, that's the particular aspect of it that I'm going to focus on. And I'm going to focus particularly in relation to the role of community-based services within that in terms of unlocking hidden data and knowledge about drug-related intimidation. And I promise it'll make more sense, but I hope it will as I go along. Okay, so just to tell you what I'm hoping to cover, I have very few slides, you'll be glad to know, and thanks very much for hanging around. I know this is the twilight hour and people have a bit of a food coma now and it's hard to concentrate. I'm going to quickly just mention what Drive is for anybody who doesn't know. I've only one slide on the systems and structures because I think it'll make more sense to do that. And then I've one slide just on our current work, so the type of work that we're doing at the moment that's relevant, and it does speak to some of the earlier presentations about people with the lived experience informing our work. And then I suppose the reason why we're here to look at the use of existing data to inform our knowledge about drug-related intimidation. So when we think about drug-related intimidation, I don't need to tell anybody here anything about that. You're all very familiar, possibly on a personal level, certainly on a professional level, and certainly through all the media. We've been doing workshops on, the wider project of Drive, and we've been hearing lots of different feedback and experience from people about communities devastated by drug-related intimidation, talking about violence, threats of violence, murder, young people being inducted into criminal networks, being victims, and very quickly within a couple of years, engaging in intimidation themselves through coercion. We've heard people talking about housing vulnerability, either through having their homes taken over by drug gangs through intimidation, or actually having to leave their community, to leave their home just to escape it, and despair and poverty. And I know, Shay, your colleague at one of the workshops in the Garda Síochána was talking about, when they do raids sometimes and they get all this money and drugs comes in, and the sadness of finding rolled up notes with the credit union tab wrapped around in an elastic band. And we do know, of course, drug-related intimidation, like drugs, it is everywhere, everything, everybody, as you like to say, but it does impact on areas that experience cumulative disadvantage more significantly, or certainly it has a more devastating impact than other areas. And I suppose we're very interested in health inequities and responding to that. So I suppose for all of those reasons, that's why we wanted to develop, I suppose, a coordinated response to that built on the good work that had already been done. And there's an awful lot of that. And you know, the Health Research Board indeed had led out on some really good work in terms of that. Equally, citywide, the National Family Support Network, who I know they're not there anymore, but they did some fantastic work years ago with the Garda Síochána in developing the drug-related intimidation reporting programme. I might just call it DRI from now on instead of keep repeating it as long. But that was a fantastic initiative that saw nominated inspectors in all the Garda divisions around the country with a particular focus on supporting communities with drug-related intimidation. So there has been a lot of really good work done. But what was missing, I suppose, was that kind of national coordinated response that involved all stakeholders. So that was something that we were trying to, I suppose, address, if you like. So a number of agencies and task forces got together. We submitted an application. The then sitting minister was Catherine Byrne. That was the end of 2019. And there was one strand of funding, Strand 3, that was specifically for a national approach to this. That was an interagency approach and that, you know, really was rooted within the community. We were successful in that. We established the Oversight Committee, which is an interagency committee. I'll show you who's on that in a minute. And through that, we commissioned the development then of a national framework, if you like, that outlined a set of systems and structures that would support and build on the work that had been done, but that would provide a coordinated approach to the issue. So S3 Solutions won that contract when the tender went out, and through a process of consultation, they developed the DRIVE framework. So just I won't read out everybody here, the Drive Oversight Committee, so you can see who's involved. You will know most of the people. It's a good cross-section, if you like. And we also have recently recruited a Drive coordinator, and Siobhan is here. Do you want to give a little wave, actually, Siobhan? And the only reason why I'm saying that is not just embarrass her, but it is important because of the time limitations and the focus and theme of today's conference. I'm only going to focus on one particular aspect of DRIVE. But if you are interested in community implementation and some of those structures and the supports that will be available within your community, you can rugby tackle Siobhan, and she'd be more than happy to talk to you about that. And equally, Shay, in terms of the Garda aspect of that. So the key informants, you know, when I talk about this framework, it wasn't developed by us. It was developed on the foot of lots and lots of different consultations that happened and built on work that had already been completed. I won't read it all out. And through all of that work and examining, I suppose, the wealth of information that was out there, both qualitative and to a smaller extent quantitative, we know that there's certain things that are most likely to work in terms of trying to develop a coordinated response to this. I'll be focusing on the first one there, which is the primacy of data. In other words, a commitment to gathering intelligence and data to define and inform the problem, and we've been talking about that earlier on. But it's not that that's more important than the others, and it's really important to say that. So obviously interagency cooperation is critical, community involvement, so the very communities that are most impacted by this, their involvement in this. A long-term approach. This is not something, I think somebody earlier on, I think it was Dennis at the beginning, was talking about wicked problems. This is a wicked problem. We're not going to solve it overnight, regardless of how good our systems and structures are. And then programme fidelity, so using evidence-based approaches and using them in the way that they're supposed to be used, I suppose. And it's the intersection of all of these aspects of it that are going to make it most likely for this to have some kind of impact as we proceed with the project. But again, I'll be focusing on one particular aspect of it. Just in terms of where it sits in the national structures here in Ireland. So you'll all be aware of the National Oversight Committee for the Drug Strategy and the recent review that was conducted on that strategy. And following that, there was new structure set up, which involved 6 groups, strategic implementation groups, and each one of them had a particular theme they were focusing on. This is under SIG 4, which is the consequences of illicit drug use. That's the main theme of that. And so we have a number of members of the Drive Oversight Committee that sit on that group and will be, communicating progress as we develop through that. Siobhan is probably the most important person in all of this at the moment, because the community implementation needs to have a focal point. Siobhan is that focal point and will be leading on that. And it's important to say that that was a very good choice. Siobhan's background was in the Family Support Network as a development worker and would have helped develop that training programme for the drug-related intimidation reporting programme. Since then, she came to the North Dublin Regional Drug Task Force as the Family Support Specialist before this role, where she worked very, very closely supporting victims of drug-related intimidation, but in partnership with the nominated inspector locally. And there was a number of convictions through that, as well as a huge amount of support provided to family members and to drug users who are experiencing drug-related intimidation. So Siobhan will be setting up a number of structures. That work has already begun to happen, including drive interagency groups in communities, which is an interagency structure, and each one of those will have a liaison person to support that. There is lots of elements to drive. There are some of them in terms of the national coordination, the linked community structures. There will be new training developed. That's a co-production group, including people with the lived experience and nominated inspectors and others. And through that, we'll be hoping to have a consistent approach to this, improved referral pathways, very much a focus on victim support, also recognising that law enforcement is important also, and developing communities of practice around the country in relation to drug-related intimidation. But I'm going to focus on the two elements I've highlighted in green here, the role of community services within that, and how we might capture better data to inform our knowledge base and evidence-based responses. So I suppose with Drive, it presents a number of opportunities. Certainly closer collaboration with nominated inspectors and the DRI reporting programme, and we did see that as we went around the country. It's very patchy, and that's not to be dismissive of the guards. We have a fantastic relation with them, and it was a really good collaboration. However, it is happening to a different extent in different areas. So there is an opportunity now to build the capacity of communities and awareness about the processes and supports that are available to them, and to provide screening and brief intervention at points whether victims want to proceed with making a formal report or even an informal report with the Garda Síochána. And importantly, a structure for problem solving at local level. But I'm going to be focusing on the unlocking hidden data bit of it. And I'm sorry about those other slides, but I just felt it wouldn't make any sense if I didn't talk about them. So some of the current work, and this is the last one before I get into it, that we're doing at the moment. We've had a number of meetings with the Garda Inspectorate. For any of you that haven't had familiarity with them, they're an independent body that I suppose monitor how the Gardaí are using their resources. So we have set up a number of meetings with them and people with a lived experience of drug-related intimidation, because they're very interested in how they actually experience their engagement when they go and they do make a formal report or they do report it. And I can tell you that the feedback that we got from the Garda Inspectorate was incredible. You know, they were blown away by it, and they'll be making recommendations then to the Garda Síochána in relation to how they manage that. We've had, I suppose, we're in the process of a roadshow. If you haven't been at one of the information events about the wider Drive project, Siobhan will tell you when the next ones are coming up. Obviously, Siobhan is in place, and there is an outline of systems and structures that will be in place to support this. I'm going to be focusing on the data collection bit. So I suppose currently, in terms of data collection systems or formal data systems for drug-related intimidation, so the nature and extent of drug-related intimidation in Ireland, really the only robust one that's used in a standardised way, if you like, around the country is within the Garda Síochána. So you can imagine that that's quite narrow, because a lot of people won't, go to the Gardaí when they experience drug-related intimidation. So, I mean, Shay has explained to us before at the different workshops about a new marker on the Pulse system where drug-related intimidation can be captured as a motivator for a crime. And then also, I suppose, there is data available in terms of informal and formal reports to the drug-related intimidation and reporting programme. But there is a whole wealth of knowledge about drug-related intimidation that is not being captured in a formal way at the moment. And that's really the potential sources of data on drug-related intimidation, because all over the country right now, in different support services in communities around Ireland, there are family members and people who use drugs disclosing that they are victims of drug-related intimidation. That isn't, well, while it is being captured at local level in terms of individual level, it isn't actually being captured in any robust data set anywhere. So, if I can make this work. So then why community drug and family support services? Well, first of all, because they are the primary source of support for people who are experiencing drug-related intimidation. And we know that from speaking to people who are experiencing it, that more often than not, and it's not that the guards are bad, Shay, I'm not saying that, but more often than not, because of the fear, the stigma, the shame, and maybe previous, negative experiences in the past, they're not likely to go to the Gardaí at the first point. More often than not, it is going to be in a community-based drug and alcohol service or a family support service where this is actually disclosed and people seek support. And that's because they are trusted services. They may have already had a relationship with them through seeking support for drug use, or as a family member, they may not have known where else to go, and they rang the HSE helpline or somewhere, and they've been put in contact with a family support service, and that's something we need to work on. And generally, it's because of fear of going to the Gardaí. So we know that information is being captured. Certainly, I know in family support services that I'm aware of. And the community-based drug services, these questions are already being asked, and this information is already being shared, and support is already being provided. But it isn't going anywhere beyond, the filing cabinet or the client file, and there's such a wealth of information that we just don't have to help inform us about what's actually happening in the country. And also, most project workers, family support workers, and people working in community-based services are already using existing data sets. They're already completing NDTRS, National Drug Treatment Recording System data. So they're used to capturing sensitive information and reporting that in an aggregate way. So there's no personally identifiable information in the reports that the HRB produce. And those reports are really useful. I've used them lots of times. I'm always going on about Susie lines. I think people think I'm obsessed with Susie at this stage because we've been using those aggregate reports for years for funding requests and things like that, because we have the evidence to show the need. So I suppose that is some of the reasons. There are many why this is a good idea. And then, when you think about what is the type of information that would be useful, that would tell us something about how we might approach developing policies or plans about drug-related intimidation, and is already being asked, but maybe not captured in a more standardised or formalised way. So screening, for instance, it's not currently on the initial assessment form, so that would be a useful thing to do, to maybe just ask the question, have you experienced drug-related intimidation now, or has that happened in the past? And then we looked at different things like what is the drug, because we know that's changed. Certainly when I was a frontline worker a long time ago, I think every person that I supported, it would have been heroin. Things have changed now. Cocaine is very prevalent. There's other drugs as well. So it'd be useful to know that, I think. Drug deaths, most of the time it's connected to a drug debt. It would be useful to know, well, what are the amounts? What are we talking about here? And if people are paying it, how are they paying it? What was the form of intimidation? Because we do know anecdotally, just from talking to colleagues, because we talk to each other all the time, it does seem to manifest itself differently in different areas. So, was it threat of violence? Was it threat to you, threat to a family member? Was it actual violence? Were you asked to hold something like a weapon or other drugs? Or, was it sexual favours? Was it, a pipe bomb? Like, what did it look like? And then the age profile of the intimidators. And again, I suspect that this is something that is different now. That's my sense of it, but we don't really know, because at the moment we don't really have a system for capturing this. And what interventions were provided, because we know that in community services all over Ireland, there's a huge amount of support being provided to family members and people who are experiencing drug-related intimidation. It's not been captured anywhere, but we know there's things like, 5-step interventions, counselling, safety reduction plans, referrals to the nominated drug-related intimidation inspector. But again, it's not really been captured anywhere. So We developed a questionnaire. We had huge support from Susie Lyons and the HRB that looked at some of these markers that might be interesting to have information about. And we thought, well, it would be sensible to really see whether this would actually work. We know the questions are being asked, but if it's being done in a formal way, how people would feel about that. So we conducted a scoping exercise. Through the task forces, we invited service providers to engage with, over the course of 3 months, with anyone who came into the service to ask these questions to see what their experience of using this questionnaire was. And it wasn't, we didn't want the data at that point about, you know, the number of people or anything like that. What we were really looking for was, what was it like to ask those questions? Did they make sense? What was the reaction you got? Were people happy enough with how they were worded? That kind of thing. We got the feedback from that, and we changed the questionnaire a little bit. In general, the feedback was very positive. The frontline workers were very happy that they had this, I suppose, tool to use, and the people who had experienced drug-related intimidation were more than happy to answer the questions. So I suppose that was a very positive outcome. It wasn't a big piece of research, but we needed to just do some scoping before we went any further. So in terms of the next steps, so we've been working very closely with the Health Research Board, and obviously because the Health Research Board is really used to handling massive sets of data that contain sensitive information and doing it in a safe way in terms of data protection and all of those things that you need to consider. Susie is our lead person there, has been working on that, and I believe is doing a presentation soon with some ideas about how that might work. So at the moment we're looking at phase 1, which would be current NDTRS users. So these are frontline practitioners who are already using a very similar system, and augmenting that, and family support services. Down the line, we'd hope that then we'll start to include other community-based services like family resource centres and that, who also would be providing support. And then we need to look at training, support, and then actually starting to develop reports to see how it looks like, what we're really learning about the nature and extent of drug-related intimidation in Ireland. This is my last slide. And I suppose the all-important one is, how will it help? Like the so what question. I think Shane Butler always used to say that to us, like, so what? But it should help inform research and knowledge about the nature and extent of intimidation, drug-related intimidation. It should give us a closer estimate, and it would be just an estimate, because not everybody will go to support services either, about the true level of unreported drug-related intimidation. We just don't have that at the moment. It should help show trends and patterns. So, are there regional differences? You know, does it look different in rural areas or, you know, urban areas? And then we should start to be able to build up national and regional profiles about what it actually looks like. So is it, you know, young people? Is it, you know, what type of drug is it? What's the nature of the intimidation? And that will help us then to start identify gaps and support needs. So, for instance, in a particular area, it might need some very targeted street youth outreach, for instance, if, you know, it seems to be coming back that it's consistently, you know, very young people that are engaging in this. And then, of course, it will highlight the hidden work that's already being done in community-based services, because a lot of this work is already happening and it's just not been captured anywhere. So in the same way that I can submit funding applications and I can get resources into my community because I can show the level of need through the NDTRS, I can't do that at the moment for families or for other victims of drug-related intimidation. So that is me. Thank you very much. Oh, and thank you to Susie.
Thank you very much, Brid. That's really interesting. It's just permanently fascinating how many different tentacles, you know, drugs embed into different parts of the community. So, I mean, we're certainly, you know, we're sometimes just looking at it through one lens, but there's so much happening simultaneously. So it's really interesting. Thanks for that. I'm going to just hold off questions till the very end, if that's okay.